Okay, part 7 or 12, I don't remember what part we're on, but now we're going to learn how to give a patient a breath. So, how do we give a patient a breath? Why would we be giving a patient a breath? So if our patient is here and our patient is under surgery and we're not doing too well under surgery, we're not breathing on our own, we are advanced enough in technology to where we can help them and we can give them a breath. So how do we do that? We make sure that our oxygen is on, firstly, because if your patient is not breathing under anesthesia, make sure that it's because they have oxygen going to them. Secondly, we have our pop-off valve. We talked about how important this pop-off valve is on a previous video. So we want to make sure here, this is the time that we close the pop-off valve. So how do we do that? We turn it, but not too tight, because if you turn it too tight, it's going to be harder for you to open it. So we're closed here. I have a 50-pound dog, so I'm going to go up to the 20. So how do we do that? We do it very gently up to the 20, we release, and then we open. So there are a lot of things that can happen if you do this incorrectly. We don't want to explode anybody's lungs. So before you try this for your first time, make sure that you have somebody with you who is monitoring this so that you don't make a mistake that could be detrimental. So things that could go wrong that you should not do. If you have a tiny itty bitty dog and you come up and you push this up to the 40 or the 60 or anything that's over 10, you have the possibility of actually exploding their lungs. And that could be something that is possibly life-threatening, unable to fix. I would say that you would not want your lungs to be exploded. So it's very important that you make sure that your needle gauge you're paying attention to. If you have a large dog, you can go up to the 20, large meaning 50 pounds or over. If you have a medium-sized dog, such as like a beagle or something that's, I don't know, beagle-like, you can go to the 15 here. And if you have something small, most veterinarians do not want you going over the 10. So if you have a kitten or a small morkie or whatever those little things are, you don't want to go over the 10. So again, in order to give the breath, you turn your pop-off valve closed. You give up to the 20 for a 50-pound dog. So this is up to the 20. Now let's pretend that we have a beagle-y looking thing. We're going to go up to the 15. So close the pop-off valve. We're going up to the 15. And then we release. And then for our little kitties and small little puppies, we're going to go to the 10. Close again, up to the 10, and then we release. So just to reiterate, the things that we do not want to do are coming up and grabbing the bag. So the pop-off valve is open. So let's pretend that the pop-off valve is closed. What you don't want to do is come up and grab this like this. You want to make sure that when you are giving a breath, you're doing it gently so that you don't push this over the edge to a place that you can't recover from. So make sure that it is a gentle motion. So again, let's close this. So our machine is actually leak checked, so you'll see that our bag will start getting bigger. So in this theory, we could pretend that this bag is connected to our patient. We give a breath. We don't want to go over the 20 because we have a 50-pound dog, and then we release, and then we open again. This could be given every 10 seconds per the doctor's discretion. If your patient is not breathing and it's been a long time that he hasn't taken a breath, you can give one, but if you're finding that they're still not breathing on their own after about 2 breaths, make sure that your veterinarian is notified so that they can tell you if they want you to continue to be a human ventilator or if we need to give any kind of medication. So now that we've given our breath, let's do it one more time. We close. We have a 50-pound dog. We're grabbing gently, bringing it up to the 20. Once we release, we open our pop-off valve and we wait for 10 seconds. Make sure that they're breathing on their own. They're not. So we close up to the 20, release. Making sure that you guys understand how important it is that your pop-off valve is open when you are not directly controlling their breathing. And I think that's it.